Okay, hello everybody. I am Kelly McDevitt, the president of IBI. Thank you for joining us today on our webinar regarding the cost of lost hours due to COVID-19. As you all know, the pandemic has created a huge burden for employers and employees from a cost perspective. But as you also probably all know, many employers typically consider the cost of an illness itself in their trending and in their projections, but what they don't include is the productivity costs. I think, if nothing else, the pandemic has taught us that the cost of productivity and someone actually sitting in their seat, not only physically, but mentally and from a well-being perspective, is a great burden to employers. And so, as we do every year, we go out and ask our 1,800 plus members here at IBI, most of those are employers, what they'd like us to research. And last year, this was a very hot topic on their minds, what the pandemic had really cost them from a productivity perspective. And so when we do our research, we try to go out and use very large publicly available data sets from our research team. And then we typically bring back those findings to our research committees on the particular topic with the SMEs involved. We go through the findings and really drill down into the things that employers can, first of all, understand the data. We present them in layman's terms, and then we also go out to our employers that are on our board and our members and ask them what they have done or will do about that particular topic. And so that's how we present our research out to the market, so that there are actionable items for employers to actually apply in their strategies going forward. The other thing that we do with our research is we try to get a partner, because we use publicly available data sets and they're typically asking employees questions. People may answer in one way one day and something else a different day. And so we like to see how those answers really play out in the real world, in the claims data. And so we always invite one of our board member partners to help us present that sort of survey philosophy with employees, and then what actually happened in the claims data. This time around, we've asked one of our board members from UnitedHealthcare, Craig Kurtzweil, to join us and present what he saw play out in the data. So without further ado, I'm going to introduce our researcher on this particular project, Carole Bonner, and she's going to take us through the research findings. And then Craig Kurtzweil, who is the Chief Data and Analytics Officer for UnitedHealthcare, is going to take us through the claim findings. And then I'm going to kind of wrap us up at the end with some employer guidance that we got from our board members. And then we'll open it up to Q&A. You can gladly put your questions into the Q&A box during the presentation, and I will present them at the end. Okay, thanks. Let's go, Carole.
Thank you, Kelly. Hello, and welcome everybody to today's webinar, Cost of Lost Hours Due to COVID-19 Pandemic. I'm eager to get this one going, but before I do, 3 simple housekeeping items. We're recording the webinar and it will be sent to attendees, so you'll be able to revisit the things that I talk about. Second, I've written an insights paper, so if you want to dig deeper, you can go to that paper and you can revisit that as you like. And the third piece, Kelly already mentioned, we want this to be interactive, so please post any questions that you have to the Q&A box, and we will reserve time at the end. So today I'm going to touch on background of the study, which includes research questions, data sources, and methods. And then I will hop to the findings. A macro view will give you the results as it impacts employers, as well as a micro view, which will look at how it affected each employee and diversity, equity, and inclusion. And then we'll talk about the implications of the results. The pandemic is responsible for increasing absenteeism, and it continues to have significant adverse economic consequences. So to better understand the economic burden of the pandemic, this study focuses on lost hours and its associated costs. So we will look at the research questions, just how many hours were lost that can be attributed to the pandemic. What are the costs associated with those lost hours? How that differs by industry, the reasons for lost hours and how that compares to previous time periods. Then we will talk about how these lost hours and associated earnings differ by employees' socio-demographics, and who was disproportionately impacted by those losses. The data set that we're using is the primary source for labor force statistics for the civilian population in the US. It is the Current Population Survey, which is a monthly probability selected sample of about 60,000 households in the US. It's conducted by the US Census Bureau for the US Bureau of Labor Statistics. The data are publicly available. It is nationally representative. It's a rich survey that collects information on employment, number of hours worked, reasons for being absent, earnings, and socio-demographic characteristics of the labor force. So it's good information, but what is especially unusual is that it is made available 1 to 2 months after collection. So it's one of the few sources of current data. The time frame we're looking at is, we will look at the 2 years prior to pandemic, March 2018 to February 2020, and this is used as a baseline for the study. What happened then, we would have expected to happen. It's been very consistent prior to pandemic. But of course, pandemic happened, and year 1 was the acute phase. And this is where we saw the more losses, year 1. March 2020 to February 2021. Year 2, things began to settle in, and we will look at March 2021 to February 2022. So let's take a look at how this impacted employers. We conducted a pre-post analysis. That's before the start of the pandemic, and we compared it to after the start of the pandemic. The average of the 2-year period prior to the pandemic is used for a benchmark. The total for that year, that period, is 13.2 billion lost hours. Then it shot up in the first year to 18.4 billion. And it came down some to 14.6. So that benchmark is what we would have expected. What we got was 39% above what we would expect. That's 5.2 billion. Second year, it's still 11% above what we would expect, which was 1.4 billion. And that gives us a total of 6.6 billion hours attributed to pandemic in these 2 years. Looking at reasons, we have 2 ways that they looked at it. If you have reduced hours, or if you had no hours at all, and you had been working 35 or more hours. So pandemic related are economic, illness, childcare problems, and other. And I'll talk about all those in a minute. The things that we did not consider in these calculations are things like PTO and holiday, weather, those kinds of things. So going to economics, this accounts for 20% of pandemic-related reasons. This is slack work, slow work, business conditions. You could only find part-time work, 20%. These two buckets, no work is the blue line and reduced work is the orange line. And we'll talk about why I've separated those, but it gives you a better view of what's going on. So in pre-pandemic years, there were far more employees who lost all hours for economic reasons, that's the blue line, versus had reduced hours. When the pandemic hit, reduced hours increased threefold, whereas no work increased a lot, but relatively speaking, less, 69%. And then in both cases, it came back down. Illness. This reason is the biggest bucket. It's 48% of the pandemic-related reasons. It is the employee's own illness, injury, medical appointment, health, medical limitations, and this also includes self-isolation and quarantine. So you have two scenarios. Again, the reduced hours, the orange line is at the top. In pre-pandemic years, these two buckets were relatively close, but when the pandemic hit, those whose hours were reduced increased significantly, 69%, and it actually continued to increase in the second year. While those who worked no hours actually decreased 7% in that first year, but then rose a little bit in the second year. Childcare problems. We heard a lot about childcare problems throughout the pandemic, and it only accounts for 1% of pandemic-related reasons as respondents specified. It could be in the other bucket, but they specified childcare problems 1% of the time, and it was consistent. It still accounted for 1% throughout pandemic. However, those who reduced their hours because of childcare problems increased by 34%. That's, yes, 34% in the first year. But those who didn't work at all due to childcare problems increased by 148%. And both came back down the second year. So we've got this other bucket, and it was an open-ended question. There were lots of people who didn't know what to call their reason during the pandemic. So 31% is classified as other. So those who did not work at all due to other reasons, the blue line, increased by 384% in the first year, came down in the second year. And those who worked fewer hours in the first year increased by 236% and came down in the second year. And so if you look at the big picture, all the reasons came down in the second year except illness. Illness actually went up in the second year. I have another view of this, and that is year over year, and it goes all the way through December 2022. And you'll see illness in 2022 has increased 62% over pre-pandemic. So this has huge implications for employee health and well-being post-pandemic. Cost. So the question is, how much did this cost us? And so we looked at wages and benefits. You'll see the sources here. And we took lost hours, multiply it by earnings. And then there's an absentee multiplier that comes from a methodology that we have used throughout our tools at IBI. And if you want more information on that, you can see the report and there will be links. Cost, pre-post again. We're going to look at benchmark period, 460.8 billion is the benchmark, right? First year, it goes up to 628.1. And then second year, it's at 506.4. So expecting that benchmark, in the first year, we had a 33% increase, which is 167.4 billion. The second year is a 9% increase, which is 45.7 billion. Total of 213.1 billion. This is cost of hours lost attributed to pandemic. Some industries suffered more than others. These are the top 5. This is year 1 losses. No, this is overall losses. 30.8 billion for education, healthcare, and social services. 27.1 for government positions or industry. 23.9 billion for construction. 22.4 billion for waste management. And 21.5 for manufacturing. And for all industries, there are positions that were overworked, there were positions that were underworked. It's very nuanced, and you will find more information in the insights paper. So let's look at the impact to employees. Right? Overall, the average loss per employee was 79 hours first year, 77.7 the second year, which is about 2 weeks' pay. And according to Career Builder Survey back in 2017, 78% of US workers say they live paycheck to paycheck. It's not just low-wage workers who have the problem. Nearly 1 out of 10 workers making 100,000 or more say they always or usually live paycheck to paycheck, and 59% of them have debt. So these losses, 2 weeks' pay, which is average, can be catastrophic for households. If we look by location, the first year, on average, employees who lived in South Carolina lost an average of 108 hours per employee, followed by Louisiana, 99 hours, Kentucky, 90 hours, and Colorado, 89 hours. Year 2 is different. We have the biggest loss in Alaska, 109 hours, followed by Nevada. Average hours lost for employees in South Carolina remained high, 100 hours per employee, followed by Mississippi and Iowa, 96. So we look at sociodemographic differences. We're looking at disparities. So for instance, these are just some of the data points. For instance, females are 45% of the workforce, yet they lost 48% of the hours. So they had a 2% disproportionality. which meant that men actually had 2%, they gained 2%. Black, African American, they were 15%, 13% of the workforce, yet they lost 15% of the hours. That's a 19% disproportionality. Hispanic, 33% disproportionality. And age 25 to 34, they actually won. They're 25% of the workforce and only lost 22% of the hours. When we look at disproportionalities, it's easy to have these buckets, these female, Hispanic, so on and so forth. But all of us have different identities. There's something called intersectionality, which surfaced in 1989, which combines, it looks at all of a person as a whole, all the identities, race, class, gender, other characteristics. So just for an example, if we have a Black male who has a bachelor's degree and is 45 to 54, he's 10% of the workforce, yet lost 13% of the hours, which is a 37% disproportionality. And as you saw on the prior slide, 19% was just for Black employees. So he's hit harder. He has many identities, and it's sort of a layered effect. And another example, Asian female high school diploma or equivalent, 45 to 54, is 12% of the workforce, yet lost 17% of the hours. That's a 33% disproportionality, whereas Asian is just 11%. So it's important to look at the whole person to understand how to support these individuals. As employers and employees adapt to the changing dynamics of workplace and to better understand how to mitigate further losses, IBI seeks input from employers. The key points are here. The first point that was a common concern for employers was communication. Communication is a key element. Leadership has to think differently about how they show up, how they communicate, how they interact with employees. Honesty and transparency are the most important part of promoting trust. Communicate broadly and through multiple channels. Don't be afraid of social media. These things are important if we're going to mitigate some of these losses. Kelly, you want to weigh in here?
Yeah. So, I mean, obviously, we ask our employers, board members for guidance on how to move forward from these things. Obviously, I think one of the big lessons that we learned from the pandemic is that we really blurred the line between our social contract with employees that we had pre-pandemic and what we have now. It used to be that sort of work was work and home was home, and that trust level and open line of communication was a pulse survey every year. And, now forevermore, I think that is gone. There's no more work-life balance. There's just life balance. And so when we talk about communication, we're really talking about communicating in new ways. And I think that employers, including with this particular topic and things like mental health and caregiving, et cetera, employers are now more often meeting face-to-face with employees. They're creating employee groups to be a part of so that they can deliver messages, not just in a mailer to home, but they can create open lines of communication especially for those in a hybrid or fully work at home workforce, that are really new and easier ways to communicate between employees about what resources are available to them through the health plan and outside the health plan. I think we're learning more and more. We have one particular employer on our board who did something I thought was pretty brilliant. In every communication that they send to an employee through their inter-office email, there is a little red button on that email that says send to home, because they know that, their workforce is primarily male and not decision-making from a healthcare perspective. And so they make it very easy for their employees to forward that email to their spouse or their significant other at home. And that's just one way that they found they are able to get the word deeper and broader within their organization. The trust, safety, inclusion, this, really started during the pandemic when we first started safety protocols within the office, the hand sanitation stations and the plexiglass and the testing and the masks and the gloves and those types of things. I think employees were looking for guidance outside of the sometimes mixed messages that they were getting from the government and elsewhere. And so really turned to their employer for that type of guidance. And while none of us trained in infectious disease protocols, I think employers had to learn very quickly to become the trusted source of information. And so, right, wrong, or indifferent, that helped for many companies to build a sense of trust with their employer to be able to get that information through them instead of other channels. And then obviously, the sort of back to basics. If we are indeed in a post-pandemic world, which I'm not sure I agree with, it still rages on, especially for international employers. Getting people back to care is something that we're, I think, all still struggling with a bit. And we have a different research project on delayed care, particularly, that speaks to this, but we are still seeing in the data that many people out there are still afraid of getting or giving COVID, a much larger number than we expected to see. There are still many roadblocks that Carole alluded to for barriers to care, and that we are concerned about, those including financial barriers, care deserts, depending on their jobs, whether they're able to get off work to have care. And then lastly, the system itself being able to take back the volume which we have in the system right now. We have, obviously, as you probably all know, very many staffing shortages in the healthcare world, and even some hospitals that are now closed due to the pandemic. And so we still have scheduling and availability problems in the system. And so those things really need to be addressed by employers, and many are taking a sort of back to basics approach. Go back for your preventive care, go back for your routine physicals, go back for your immunizations. And while we do have virtual solutions in place for some of those things, I think we all agree that, in-person and medical home type care with your PCP or your specialist that you've already been using is the gold standard. And some employers are concentrating on how do we design a benefit strategy that can better prepare us for the next time, the next wave, the next variant.
Another thing, Kelly, that keeps coming up in this and current research is psychological safety. Very important. We talk about mental health, but as we come back to the office, there are lots of environments that don't feel psychologically safe for people, or they were very comfortable in their home environment. So we have to consider that as we move forward.
Yeah, good point. I think one of the things that employers are still struggling with, I was at a healthcare conference 2 weeks ago, and one thing that many employers were talking about was the return to office strategy because of, post-pandemic guidelines, the shrinkage of workspace.
Yeah.
For those employers who closed offices or, downsized their footprint in a particular building. The struggle now is real of what strategy or multiple strategies might work best for their employees, and how to not only attract and retain through those strategies, but to serve those who are now, for all intents and purposes, working at home on a full-time basis. Just because they say in their surveys that they want to and will only work at home doesn't mean they should. So employers are really struggling on how to approach that from a strategic perspective. In the old days, we used to make someone earn the right to work at home, based on their personality, if they were independent workers, if they met either quality or production guidelines. And now we just kind of sent them home and created a precedent. How do we pull them back without losing employees? I think employers are really still trying to form their return to office on a permanent basis strategy and put that in place. And because they've kind of flip-flopped, we're going back, we're not going back, we're going back 2 days a week. Is it the same 2 days a week or 2 different days a week? And, having a purpose to come back into the office and come together, it creates a sense of imbalance for the employee because they don't know what to expect. So that uncertainty causes stress, and that's just not good for mental well-being. Okay. So we're going to go over to Craig to present the data found in the claims from UHC. Craig?
Thank you, Kevin. And I'll jump in. I lead analytics for UnitedHealthcare, so I'll be talking about some of our data and connecting the dots into what Carole just presented to show that there's a connection between what we're seeing in claims data versus what you're seeing in the productivity side of things. And so as you think about what Carole just walked through on the productivity side of lost days, we're also doing a lot of analytics to see what is the impact of COVID, what is the impact of COVID from a healthcare expense perspective. So as we look at some of the data on this screen, when we're looking at a portion of our book of business, where we're looking at all of the costs associated to treats, to tests, and to vaccine against COVID. And so overall, in the portion up above the chart, you can see the average cost per employee per year that was related to the treatment of COVID. You can see that went from $183 up to the peak of $378 during the heart of COVID, from the healthcare expense perspective, 2021, and that has come down dramatically in 2022, and even more so as we go into 2023. But as you look at that by the industries that we serve, you can see that not every industry was created equal, depending on where your workforce was and how at risk they were in catching and spreading COVID. We are seeing that different parts of the different industries got hit hard. So, for example, in our book of business, the hardest hit industries during the heart of COVID in 2021 were the, as you'd expect, transportation industry, but also the energy industry actually had a significant portion of costs associated with COVID during that time period. Now, in the other bucket that's interesting to note, service would be in that top 5. That actually was hit hardest in the first wave and the first year of COVID, came down in the last 2 years. So it was really more of a year 1 exposure there. And the same thing when it comes to healthcare, where in the first year of COVID, you would have highlighted those 2 industries as being dominating COVID-related costs. Really was more of a year 1 phenomenon. And then as that rolled forward into year 2 and into year 3, we see costs drop down pretty dramatically for both of those. As you can see, when we align that to what, when we align that against what we see in the industries from a workday reduction perspective, you can see that we've seen similar reduction in those industries. And I don't know, Carole, do you have the ability to go back 1 slide? My arrow is not open. But as we look at what that looks like, leveraging some of the IBI data to understand, is there a connection between what we see on the healthcare side? You can see that there obviously in some of these key industries, you can see that the rapid increase in reduction of lost days associated with the pandemic definitely ties to what we just talked about. When you look at some of the energy business as well as the service industry, you see that huge increase in what we saw in year 1 and then year 2 of the moderate. increase in those areas where we saw other populations start to more rapidly increase. So the same phenomenon as you follow the curve of COVID in total and by industry can be felt on both the healthcare expense perspective and what we're seeing from a loss of day value perspective. And if you start to look at that on the next slide by state, you can also start to see that not every state was created equal. And we see that, again, in light blue is 2020, and in gold is 2021, and dark blue is 2022. And you can see it's not early on in the pandemic, we could have focused on just a few states that were driving severe COVID expenses, especially in the Northeast, with New York and New Jersey being the first. But now, as you look back, every state had their peak, regardless of where you are. Almost every state had dramatic costs associated with the pandemic, regardless of issues that were put in place or policies put in place. Every state had their day when it came to COVID-related costs. It was just a matter of when. And especially some of these smaller states where we had, obviously smaller populations, but dramatic swings in what we're seeing from a pandemic cost perspective. When we look at what does this look like overall in 2020, we saw that about 3.5% of medical spend was focused in on COVID-related expenses. When we jumped into 2021, in the heart of COVID, we got up to over 4% of medical expense dominated by COVID. And now, as you go into 2022, down below 2%. And I can tell you an early look at 2023, we're going to be much lower than that, below 1% of costs associated with COVID. Well, so dramatic changes, and even in the heart of things, even as bad as it was, we saw that the peak of COVID-related expenses went up to about 4%, with some populations being much higher than that, much lower, but the average being at about 4%. We also look at different segmentation, just like Carole did. So if we look at some of this analysis by gender, you can see that relatively comparable sort of shifts in spend, but the costs associated with COVID definitely skewed towards the male population. And a lot of that is going to be due to some of the more health risks that we see in our population with some of the metabolic issues, and obviously the obvious connections to a higher risk of more severe COVID when you have some of those metabolic issues. And as you start to look at this even by generation, and again, this swung a lot in the early parts of the pandemic versus later parts of the pandemic. But if we look on the left-hand side, we can see where the exposure was, and really in this view dominated by what we're seeing in certain generations, especially the millennial population and the Gen Z population will be dominating what we see from a COVID exposure perspective. And then as we look forward and start to say, it's not just about COVID itself, but what are we seeing from a long COVID perspective? First of all, as we look at UnitedHealthcare data, the code, there's a ICD-10 code associated with long COVID, but providers are rarely utilizing that code. In total, we're seeing about 1%, less than 1% of the population being coded with long COVID. We know the actual results, the actual impact on the population is much higher than that. And you can see some of that here. As you pull in other sources of data, you can see that people that identify as having these long COVID type symptoms, it's more like 30%. And if you start to segment that out, you start to see some populations being hit harder than others. So for example, from a health equity perspective, we see that it definitely skews much higher into the Hispanic and Latino population. So this is going to be a longer term issue and longer term issue for the U.S. healthcare system, but there's a big disconnect between what you're likely seeing in your claims data versus what actually is happening across the population. With that, Kelly, I'll hand the ball back to you.
Thank you, Craig, very much for that data look, especially around the long COVID. I think that this particular issue displays the huge disparity in the conversation between what happens in the medical claims and what happens in the disability claims. Now, unfortunately for all of us in the productivity world, there was no ICD-10 code for COVID-19 in 2020. And so now as we examine and of course, all employers wanted to know, what's COVID costing me in 2020? And we didn't really know. We took a good guess based on the upper respiratory disease that we saw being reported in 2020. 2021, obviously we had a code. I would say for the first few months that we had that code in 2021, we still had providers who weren't using it. So it's probably understated But as we examine that data now, we see that much of the cost of the disease, COVID-19, and the medical spend, as Craig showed it at its highest, 4%, it still, doesn't hold a candle to diabetes and cancer, right? However, on the productivity side, where people were not at work, even when they weren't sick, they were isolating or in quarantine. And so they missed a lot of work. And so we'll be publishing that 2021 data here in the next few months. And as that continues into 2022, obviously the numbers will come down. But I think that it's very important that as you look at benchmarking the true cost of COVID-19, it's not just the medical spend or the pharmacy spend, which is pennies on the dollar, but the cost of lost time. So using the IBI for IBI members, using the IBI benchmarking data will become extremely important to form that more holistic view of what's happening in the population. So with that, we had a question, and we did answer the first question, which was from Fred, the intersectionality findings, to what extent is that explainable by the type of industry that particular intersectional category is most represented in? And Carole answered, just for all of your edification, there are intersectionalities by industry. We looked at some of those, and occupation, which determine the extent of an employee's losses. And that is actually covered in the full report. Obviously, we didn't go over all of the findings here on the webinar, but for those of you who are an IBI member, you can find the full report, research report, on our website. And then the second question was, are we able to spike out long COVID in the claims data? And Craig just went ahead and did that, and that will be included in the deck for all attendees today. And again, if you're not an IBI member, you won't be able to see this research until it is no longer embargoed on our website and becomes public, which is 90 days. If you are an IBI member, obviously you can see these full reports and the one-page infographic on the cost of COVID that we have published in social media. So I don't see any other questions in the Q&A. Anyone else have any questions that they would like to ask? Please put it in now. Okay, great. Well, listen, obviously this is a particular topic that we continue to follow. We hope that employers will continue to monitor not only their spend for COVID-19, but COVID related, and obviously long COVID has become a huge topic of consideration and challenge for employers, not only in the medical space, but as I said, in the disability space, as some of those long COVID claims are now turning into LTD events, which, as you all know, can become very costly. So we will monitor that in our benchmarking data at IBI and be reporting out on that as a topic. And then as you continue to follow our research, this sort of bleeds over, as I mentioned earlier, into our delayed care research project, which we will be publishing here in the next few months as we finalize it. And we will be having a webinar on that particular topic as well. So please join us for that. So for everyone who joined, thank you for your time. We really appreciate you, Craig. Thank you for helping us to present this data so that we could see the full picture. And Carole, great job on doing the research and presenting this data out. Thanks, everybody.